Hi, my name is Madeline Moses. I'm a pharmacist and diabetes educator at Mathis Community Pharmacy in New Albany, Indiana. We decided to start a national diabetes prevention program in our pharmacy after, honestly, we were contacted about the opportunity to receive grant funding from NCPA. It had been on our list of projects we would like to try in the next couple of years as an expansion of our diabetes education service. However, honestly, we were a little overwhelmed at the cost and time that it would take to become accredited. So when we were contacted about the opportunity and the support that NCPA offered, we really felt like this was the best opportunity to kind of dive in with both feet and see how this would go in our community as we continue to strive to be a place of wellness, not just sick care in our community. Some of the expectations that we had for the program through NCPA was financial assistance. Of course, we were told that they would help with training lifestyle coaches as well as some financial incentives along the way, as well as just support with onboarding such a expansive program. There are a very large document of requirements from the CDC when it comes to how to start a program like this, and it can be a little overwhelming to make sure that you're always interpreting those as we should be. So having the group support and as well as the collaboration with some of the other experts that NCPA brought on that we were told about, that was kind of our expectation, and they were absolutely met and exceeded when it came to what we have actually received as far as support from NCPA. I don't think there was anything completely out of the blue. I will say I was impressed by the variety of pharmacies that have participated in the program and that we got to work alongside with and learn from. There were people all over the country, a lot of different types of practice settings and focuses within community pharmacy, all coming together to work on a very similar project. So it was really neat to see the variety, I'll say, of practices that were doing this diabetes prevention program within NCPA's network. Some of the support that NCPA offered was in the beginning, especially in the form of scheduled webinars where we all came together. We worked on a very specific timeline that I felt was reasonable, but to kind of help us move us through the initiation of the project. We also were provided documentation software for 18 months, which is the duration that it will take for us to become fully accredited as a DPP provider through Strand. As well as, in addition to that software access, we also got support from a Strand team member who came to every one of our meetings. So each time anyone had a question during the meetings, there was a Strand professional there to answer those. And then they also provided lifestyle coach training, which is a requirement in order to be able to offer the DPP program. You have to have a trained lifestyle coach, and they provided that to us at no cost. In addition to that, there were also some financial incentives along the way. So if we met certain goals at certain times, there was a small stipend that would be sent to the pharmacy, just kind of as a reward for staying on track with that timeline that we established early on. And they also have been in almost constant communication with the CDC, given the COVID restrictions and changes, and giving us the changes in expectations that the CDC has. Because obviously, when we started this project over a year ago, things were different, and so they've helped us kind of navigate those troublesome waters of just quarantines and all the different things, virtual options, that sort of thing that have been challenging over the course of the last year. So the COVID pandemic absolutely has had an impact on our starting of the National Diabetes Prevention Program here. Of course, the first thing that comes to mind is all the challenges that it created. It delayed our effectiveness of our recruitment effort that we had. We actually were delayed about a month starting our program, but we were able to overcome that, find a different way to recruit, and we actually ended up with a very large cohort. It also required us to start offering virtual options that we had not originally anticipated, which did cost us some extra money getting that software on board that they could not have foreseen needing that when they started the grant. But we did have to spend some money so that we didn't lose people to quarantines. And then also, that it did put a challenge with our attendance and space where we had planned to hold the classes due to um, the 6 feet apart social distancing requirements and all of the mask mandates, that sort of thing. It did make it difficult. But as I sat and kind of reflected on that question, it also had some positives. And I know that sounds strange, but it taught us to be very adaptable early on. It's obvious that no program is going to be able to be rolled out exactly the same in all parts of the country. And so we were just kind of at the very beginning, figure out how you're going to make it work here. So we learned adaptability. I also feel like our participants were given a very rare chance. It was a time in their lives where everyone was forced to kind of slow down and focus on staying home and, small groups and family. And so, honestly, they had more time to be creative with their meal planning and exercise. And it also, people weren't traveling. So we didn't have a ton of people leave on vacation for a couple of weeks over the summer because everyone had to stay home. So it kind of helped with attendance in that way, as well as social distractions. So people weren't having a ton of other events going on that we were competing with because not very many other people were having things going on. And then I also feel like it did provide our participants with a source of community support that was really hard to find over the course of the last year. We were really kind of drawn away socially from a lot of our usual community involvement, and this was a place for them to come together and work with people with similar goals in their community. So in my mind, I feel like it had almost as many positives as it did negatives when it comes to the effect of the pandemic. I think our community has responded to the diabetes prevention program very well. We ended up doing a newspaper article in order to help with recruitment, and we actually received way more interest than we anticipated and even planned to have with our initial cohort. We had about twice as many people in our initial cohort as we had planned. And people were just really excited about the opportunity to do something preventive as opposed to kind of a new treatment. So it was very well received early on, and the people who did participate have done very, very well in the program. We have 19 total participants, and over half of them have met or exceeded, some of them quite exceeded their weight loss goals. So they're doing very, very well. Honestly, not that I am a realist, and they did way better than I even anticipated that they would. So they have been fantastic. As far as our keys to success, there is no one key to success. We've had a lot of trial and error when it comes to starting this program. One of the things that we have found to be very helpful as we have passed our 6 month mark in the program. So looking back very early on, we kind of had this approach to attendance as it is 100% required. So if you miss a class, you will do a makeup session. We'll get it scheduled for you, but we set that expectation very early on. And so, and they never really knew that actually the standards only require like 60 or 70% attendance. So by doing that, I feel that they were able to one, stay up on the information and kind of go through the program as a community and as a class. They stayed together through it. It also helped with attendance later on because we would have people call and say, "Oh, I don't want to have to do a makeup session. Can I come to the other class time this week?" So they kind of started enforcing it for themselves once we set that expectation. And we have never once had to worry about our percentages for attendance where we're meeting the standards because honestly, most of our people have really close to 100% attendance. So that was very helpful. And I think not just making it easier on us, but also I think that helped them make sure they were getting all of the content. My other key to success is people will do crazy things for very small incentives. So I was having a really hard time getting them to turn in food logs. They were turning in exercise minutes because that was required to be reported. They were coming to class and getting weighed in, but I could not get them to log their food. So I started telling them there would be a surprise. I didn't tell them what it was, but I would tell them there was a prize if they would bring me so many days worth of food logs. And that was every person that came in the classroom. They'd be like, "What's the prize this week? I brought my food logs. Do you want to see them?" And I mean, it was like a to go box or a like meal prep container or a little Tervis glass or cup or something. Really, really small items, but they were excited about it. And that's all it took to get now almost everyone in our class is turning in food logs every week because they're so excited about whatever prize it is that we're giving them. So that is something that has also been very, very helpful and helped us get over. We kind of hit a weight loss plateau as a class. And when we started doing the prizes, we started turning in food logs. Everyone has kind of got back on the train of losing a couple of pounds a week. So it's very effective. For anyone who's interested in participating in this project, I know that you have at least considered starting one. You've looked into the requirements and you may feel overwhelmed by all of the different documentation requirements, but if there's one thing I can say, it's not going to get easier. And there will never be more support than NCPA is offering to you. It will never. You're not going to find anyone else who's going to offer to help you train lifestyle coaches and pay for that. You're not going to find another group that is having monthly meetings of people all across the country that are doing the exact same thing you are. You're never going to find this much support unless you do it through this. So, regardless of whether you feel like you're ready, you're probably not ever going to feel like you're 100% ready. So, my advice would be to give it a try. You've got all the support that you need. And if you've considered it, then you have gone through all the checklist of requirements. And I'm sure you are much more prepared than you think that you are. So, go for it. In addition to all of the obvious things like it brings people into the pharmacy, it helps us spread the word about Mathis and our mission of being a place of wellness, not just a place to pick up your prescriptions. I think it has participating in the NCPA program has given our pharmacy and our lifestyle coaches a sense of how our program compares across the country. And are we offering the state of the art program, or who's doing something different? How can we implement that? It's given us a opportunity to really expand our program much more than we could have done with just our own trial and error in the course of the first year. I feel like we have progressed into a much more functional program quicker than we would have without the support of the program. For our patients, they benefit from that. They benefit from our learning and our ability to offer exceptional care when it comes to weight loss and diabetes prevention. So as we learn faster and do things better, they benefit from that. So we were also able to offer, due to the grant, this cohort a free of charge process through this. So not only did most of them meet their weight loss goals, they didn't have to pay anything to come through our program. So that's definitely beneficial. And I think it also has allowed our pharmacy to expand our marketing into a market we have never been in before. We have diabetes education, we have CPAP and medical supplies, but all of those things are for people who have already been diagnosed with a disease of some sort. So besides immunizations, this is really our first reach into preventive care, which I think as pharmacists, we have an opportunity, and I think we're kind of on the brink of that. And by implementing this program, I feel like we're really operating at the top of our license and doing everything that we can for our patients and community in the realm of prevention and wellness. Nobody likes to do things alone, right? It's not something that it's you will receive guidance and support for any hiccups or challenges that you would come across as you started this new service. All of the people that were provided to us as resources, the NCPA team, the Strand team, the ADCES team, everyone was not only made themselves available on the monthly calls, they also provided their contact information. So if we had any questions throughout the month, we could reach out to them. They also gave us a myriad of written resources, web addresses, all the different places we could find the information we needed in one quick location. So that made it very, very easy. Um, and I think as pharmacists, we are in a great place to help patients take control of their health and invest in their future. And so, if you are a pharmacy who is interested in providing wellness service, this program is going to help you be successful in that effort. I did a little presentation about our DPP program a couple of months ago, and I ended my presentation with a quote that said, "If you can't get over the fear of doing something, do it scared." And so that would be my advice to any pharmacies that are thinking about it. You're not going to feel super confident in your ability to do this. It feels overwhelming. It's a year and a half of work before you can even become accredited. It's a lot, but it's worth it. So do it scared.